Hello everyone, this is Dr. Arafat. I have a bachelor degree in pharmaceutical science and this is my YouTube channel, Pharmacy Tutor. As I told you before in my intro video that on this video we will start discussing medical terminology. Medical terminology is really important if you are a medical practitioner. You don't need to be a pharmacist if you are a physician or a nurse, a vet. So if you are in any field practicing medicine, concerned with medicine, you need to understand medical terminology. So here is a photo of the book that I took as a reference on which these videos are based. It's a Lippincott book, and here is an introduction to medical terminology. So if you want to study medical terminology, what do you need to know? You need to know the basic components of any medical term. So the basic components of any medical term are three parts. The first part, the beginning of the word, which is prefix. Then the root, the middle of the word, and the end of the word, which is suffix. So there are three basic components of any medical term. If you see any medical term, you need to divide the medical term in three parts in order to understand this medical term. So prefix, root, and suffix. Here is an example: hyperlipidemia. So hyper is the prefix, lipid is the root, emia is the suffix. So if you understand each part alone, you will have the total meaning of this medical term. So hyper means increased, lipid means fat, emia means blood. Now you're thinking, how would I know these meanings? Okay, take a breath, a deep breath. On the next videos, you will understand each meaning of each prefix and each root and each suffix, and further on the combining forms, because I will post on my videos every table found for a collected common prefixes, roots, and suffix. So don't worry about that. It will all be mentioned in my videos. Okay? So let's continue. So hyper is increased, lipid is fat, and emia is blood. So what you will understand? You will understand that it's an increased fat in blood. So let's see another example. So pericarditis. Peri is the prefix, card is the root, and itis is the inflammation. So peri, which is the prefix, means around. Card means heart, and the suffix itis means inflammation. So what you would understand from this term, you would understand that there is an inflammation around the heart. Okay, so that's an understanding. But when you look into the dictionary for pericarditis, you'll see that it means that it's an inflammation of the pericardium. Pericardium is the sac that encloses the heart. So you don't need to know the precise meaning, but you'll understand an over meaning to communicate with other practitioners or to understand what you're studying. If you're studying pharmacotherapy, pharmacotherapeutic, pharmacology, or whatever, so you will understand what you're studying. Okay, so let's have another example. Dyslipidemia. So where is the prefix? It's this. And where is the root? Lipid. And where is the suffix? Emia. So this, which is the prefix, means painful, difficult, or faulty. Lipid means fat, and emia means blood. So when you have a prefix that has a different meanings, so sometimes you'll find it means faulty, means difficult or painful. So but this one, it means faulty. So there is something wrong with the lipid levels in the blood. Okay? So another thing that you need to know, not all the medical terms consist of prefix, root, and suffix. Some contain something called combining forms and combining vowels. So what are these? These are medical terms that doesn't have a prefix, but it has two roots, okay, combined with a vowel. So it's called in whole combining form. So a two root and a combining vowel is called a combining form. So the most commonly used combining vowels are the O and the I. So here is an example. Hyperlipoproteinemia. So hyper means increased, lip means fat, and O is the combining vowel, protein means protein, emia means blood. So where is the combining form? Lipoprotein. Okay? Emia is the suffix, hyper is the prefix. So here is a prefix, but sometimes you'll not find the prefix. Okay? So when it starts with lipoproteinemia, you will understand that there is a lipid and protein in the blood. Okay? So you need to know that combining forms are two roots joined together with a combining vowel, which is most commonly used an O or an I. Okay? So let's have an example. Okay, so card means heart, and the I is the combining vowel. Ology means the study, so it's study of the heart. Another example, polyneuropathy. So poly is the prefix, neur is the neuron or the nerve, and O is the combining vowel, so neuro is a combining form. Pathy means a disorder, so it's many nerve disorder. Okay, so many nerve disorder. So here you saw two examples to the combining form, and the first one it used an I as a combining vowel, the second one it used an O. Okay, so here is an exercise that you will answer from the previous slides. So most medical terms have three basic component parts, which are, think about it, okay, it's the prefix, root, and suffix. The root is the middle of the term, and the space is the word ending that modifies and gives the essential meaning to the root. It's the suffix. Okay, what is the component at the beginning of the term that is used when needed to further modify the root? It's the prefix. Often a medical term is formed by one or more roots. When a medical term has more than one root, it's joined together by a combining vowel, usually an O or an I. Combining form is a root with a attached vowel. Okay, so these are the definitions of every component that you have seen through the past slides. Okay, another exercise. So here you can see that it has mentioned that there is a root combining vowel and suffix, so you have to join them together to get the whole meaning and then answer which medical term means. Okay, so this first one says that cardiology means what? So he has divided the word for you. So cardi means the heart and ology means study. Okay, so it's the study of the heart. The other one, root and combining vowel and suffix. Okay, so cardioadynia. Okay, what does that mean? Okay, cardiarrhexis, cardiopathy. Okay, you need to know all these meanings. It will be discussed through the next slides, but you will have to look them yourself, and then we will discuss them on the next video. Thank you all for your waiting and for your patient listening to my video. Please, if you have any comment or you have any topic that you want to be discussed on my YouTube channel, please leave it in a comment and I will gladly prepare it and explain it to you. Love you all. Have a great day and week.